My name is Michael Online. I'm doing the PNE203 KDD head to toe assessment. Before I start, I'm going to be scanning my room. Okay, so I'm gonna go ahead and start with my hand hygiene. I'm going to be cleaning my stethoscope. Okay, and now I'm going to be donning on my gloves. And now I'm going to start. Okay. Hi there, my name is Micah. Today I'm going to be your student nurse here at the hospital. I'm also a student student from Seneca College doing the practical nursing program. So today we're going to be doing our head to toe assessment. Is that okay with you?
Yes.
Okay, perfect. So before we start, do you need to use the washroom?
No.
Okay, perfect. So I'm going to go ahead and cover the blinds and provide some privacy. And before we start, can I just check your ID badge? And can you please tell me your name and your date of birth?
Monica Long Lion, January 12, 2009.
Okay, perfect. And now we're going to go ahead with the assessment, okay? So for physical appearance, your skin color seems to be consistent with your generic background. As for your gender and your age, is appropriate as shown. As for your body structure, can you go ahead and stand up, please? Thank you. Go ahead and sit down. Your height seems to be within the normal range of your age, and your nutrition seems to have an evenly distributed amount of fat, as well as your body posture. Your body seems to be equal bilaterally, and you seem to be comfortable in your upright position, sitting down with your hands laying on your lap. So you show no signs of distress and no signs of discomfort, okay? So now I'm going to go ahead and talk about your behavior. You are showing actively listening and you are keeping eye contact. Your facial expressions, you are showing appropriate facial expressions within the situation. For your speech, you are understandable and you will have a clear voice. As for your personal hygiene, you seem to be put well together and clean, and you show no obvious physical deformities, okay? Now I'm going to go ahead and talk about your mobility. Can I have you flex your elbows just like this? Extend your elbows just like this. Perfect. So your range of motion seems to be accurate, even, and coordinated. Now I'm going to go ahead and ask you to stand up, walk to the end of the room, back to your chair. I'm going to go ahead and check your gait, okay? So go ahead there and back. Perfect. Okay. So your gait seems to be well balanced and smooth. As for your arms are symmetrically swaying together at the same time, okay? So now I'm going to go ahead and talk about your breathing. You seem to show normal breathing signs, no signs of discomfort and distress. Now I'm going to go ahead and ask you 3 orientation questions. Do you know who you are?
Monica Long Lion.
Do you know where you are?
In a hospital.
And do you know what date is it today?
April 14, 2021.
Sure. Perfect, okay? Now, your level of conscious seems to be alert and awake, okay? So now I'm going to go ahead and inspect and palpate your head, okay? So I'm going to go ahead and inspect your head. Your head shape seems to be the normal cephalic. There's no signs of deformities, no signs of infection, or no signs of swelling, okay? And when I palpate, do you feel any pain?
No.
Okay, so no pain and no tenderness towards the head. Now I'm going to go ahead with your facial structure, okay? I'm going to go ahead and inspect. As I inspect your facial structure, there's no signs of lesions, no signs of involuntary movement, no signs of edema, and no signs of swelling, okay? Now I'm going to go ahead and palpate your face, okay? Do you feel any pain?
No.
Okay, so there's no pain and no tenderness towards the facial structure. Now I'm going to go ahead and test your cranial nerve number 7. I'm going to ask you to smile for me, show your teeth, puff your lip, your cheeks, raise your eyebrows. Okay, perfect. Now I'm going to go ahead and inspect your eyes, okay? Go ahead and remove your glasses for me. Perfect. Okay, so now I'm gonna go ahead and inspect your eyes. There's no signs of crusting, no signs of discharge, and no signs of involuntary movements. Can you go ahead and close your eyes for me? Perfect. Okay, go ahead and open them. So there's no signs of lid lag. There's an even amount of lash distribution, as well as for your sclera. It's white in color, and your conjunctiva is pink in color. So they're both normal. Okay, perfect. Now I'm gonna go ahead and test your cranial nerve number 3, which is the ocular motor. Okay, so I'm gonna have here my pen light, and I'm going to use the acronym, the Perella. I'm going to be checking your pupil size on both sides. So here is 5 mm, and here is also 5 mm. So both sides are equal, as well as your pupils are very rounded, and both sides are both rounded and equal bilaterally, okay? Next, I'm going to go ahead and do the direct and consensual light reflex, okay? So I'm going to go ahead and turn on my flashlight, go behind your ear on one eye, and the same on the other. Perfect. So for your direct and consensual light reflex, both your eyes are constricted, okay? Now I'm going to go ahead and test the accommodation. Go ahead and look at my light, the tip of my light, and as you are looking, your eyes are dilated, and as I bring it closer, your eyes converge, okay? Perfect. You can go ahead and put on your glasses now. Thank you. And now I'm going to go ahead and palpate and inspect your ears, okay? So as I'm inspecting your ears, there's no signs of discharge, no signs of lesions, and they seem symmetrical, okay? I'm going to go ahead and palpate your auricle. Do you feel any pain?
No.
And for your tragus, do you feel any pain?
No.
All right. So for your tragus and your auricle, you feel no tenderness and no pain. Now I'm going to go ahead and do the whisper test on you. I'm going to whisper 3 words to you, and you're going to repeat them back up to me, okay?
Red, pink, blue. Dinosaur, bear, and pig.
Okay, perfect. That's good. Okay, now I'm going to go ahead and inspect your mouth. Okay, first I'm going to go ahead and inspect your lips. So your lips seem to be symmetrical and hydrated. There's no signs of lesions or swelling. Now I'm going to go ahead and pull out my tongue depressor. Go ahead and open up your mouth. All right, so for your gums, they are pink in color, which is normal. There's no signs of bleeding and lesions. As for your teeth, they all seem intact, and there's no signs of looseness and caries. Okay, and as for your tongue, it seems midline and no atrophy. Go ahead and lift up your tongue for me. The base of your tongue seems hydrated and no lesions. And go ahead and lift down. So your soft and hard palate seems to be intact and no lesions as well. Okay, perfect. Now I'm going to go ahead and test out your cranial nerve number 9, which is your glossopharyngeal nerve, and your cranial nerve number 10, which is your vagus nerve, okay? So go ahead and open up your mouth for me and say ah. Ah. Okay, perfect. So your uvula and your soft palate move up and back, so that's therefore your cranial nerve number 9 and 10 are intact, okay? Now we're going to do your cranial nerve number 12, which is the hypoglossal nerve, okay? So I'm going to have you open up your mouth again, stick out your tongue. Your tongue is in midline. Go ahead and move it side to side. Perfect. Okay, can you now say light, tight, dynamite?
Light, tight, dynamite.
Perfect. So now your cranial nerve number 12 is also intact. Okay, perfect. Now I'm going to go ahead and inspect and palpate your neck. Okay, so as I'm looking to your neck, your head is centered at midline. Your neck accessories is symmetrical. There's no signs of lesions and scars and visible masses. And as I palpate, do you feel any pain?
No.
So no pain and no tenderness towards palpating the neck. No visible masses as well, and no obvious enlargement of thyroid. Okay? Perfect. And now I'm going to go ahead and palpate your carotid arteries, okay? I'm going to do one on each side, and we're going to hold it here for a minute, okay? Perfect. So your rate is 60 beats per minute. The rhythm is regular, and your grade strength is a +2, which is strong. Now I'm going to go ahead and do the other side. Hold it for a minute. Perfect. So your rate is 60 beats per minute, your rhythm is regular, and your grade strength is also +2, which makes both sides equal bilaterally, okay? Now I'm going to do your cranial nerve, number 11, which is your spinal accessory, okay? So I'm gonna apply resistance when I ask you to look in each way, and I'm gonna apply resistance when you shrug your shoulders, okay? So go ahead and apply resistance looking this way. Perfect. Go ahead and look that way. Perfect. And go ahead and shrug your shoulders. Perfect. Okay, so cranial nerve number 11 is intact, okay? So now I'm going to go ahead and inspect and palpate your arms. So go ahead and roll up your sleeves for me. Your upper extremities, sorry. All right, so as I'm inspecting, both arms are symmetrical. There's no signs of lesions, no signs of scars, no signs of visible masses. As I palpate, do you feel any pain?
No.
Okay, so no pain and no tenderness. The temperature is warm. There's no muscle atrophy and no edema. Okay, perfect. Now I'm going to go ahead and look at, inspect your nails. So your nails show no lesions. The nail surface seems clear and it seems smooth. As for your nail folds, seem clean and smooth and slightly rounded. Okay, now we're going to go ahead and test out your range of motion. Go ahead and stand up for me. Okay, so now we're going to go ahead and flex your fingers, extend your fingers, flex your wrist, extend your wrist. Perfect. Radial deviation, ulnar deviation, flex your elbows, extend your elbows. Perfect. You're going to go ahead and do pronation, supination. Perfect. And now you're going to go ahead and shrug your shoulders. Abduction, adduction. Perfect. Internal rotation and external rotation. Perfect. You can go ahead and sit down. Did you feel any pain?
No.
So no pain, no cryptic, and no altered range of motion. Okay? Perfect. Now I'm going to go ahead and do the hand grip test. Okay? Go ahead and squeeze my fingers. Perfect. So the grip was strong and both was symmetrically bilaterally. Okay? Now I'm going to go ahead and inspect and palpate your lower extremities. Okay? So as I am inspecting, there is no scars and no lesions, no visible masses, and no involuntary movements. As I palpate, do you feel any pain?
No.
So no pain and no tenderness towards the lower extremities, and no edema as well, and no swelling. Okay, now I'm going to go ahead and palpate your posterior tibialis pulse. Okay, so right over here, I'm going to go ahead and do both and wait for a minute. Okay, perfect. So your rate is 60 beats per minute. The rhythm is regular, and the plus grade is plus, and your grade strength is +2. Okay. So now I'm gonna go ahead and do the dosalis pedial pulse, both of them as well. I'm gonna hold it for a minute, just right over here. Perfect. So your rate is 60 beats per minute as well. The rhythm was regular. However, the grade strength was a +1 because it is the quality is weaker and harder to palpate. Okay, perfect. So now I'm gonna go ahead and do the plantar and dorsal flexion. Okay, so go ahead and lift up. Perfect. Go ahead and push down. Perfect. So the plantar and dorsal flexion are both strong and equal bilaterally. Okay, perfect. Now I'm going to go ahead and I'm going to inspect and palpate your posterior thorax. So go ahead and turn around for me and lift up your shirt. Perfect. So for privacy reasons, she won't be removing this part, but in reality, if I was doing this, I would ask the patient to move this up as well. So for inspecting the posterior thorax, there is no lesions, no scars, no visible masses, and no edema. As I palpate, do you feel any pain?
No.
So no pain, no tenderness when I palpate, and no swelling as well. Now I'm going to be checking the symmetry chest expansion. Okay, so go ahead and breathe in for me. Breathe out. Perfect. Breathe in. Breathe out. Perfect. So there is a sign of symmetrical chest expansion. When she breathes in, my two thumbs move symmetrically, okay? Now I'm going to go ahead and also take her posterior thorax in the 9 areas, okay? Go ahead and breathe in. Breathe in. Okay, breathe out. Breathe in. Breathe in. Breathe out. 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 And breathe in. Breathe out. Breathe in. And breathe out. Perfect. So while I was auscultating your posterior thorax, there are no signs of wheezing, or crackling. So therefore your lungs are clear, okay? So go ahead and put that down. And go ahead and turn to the front. Now I'm going to be this way. Thank you. Now I'm going to be listening to your anterior posterior, okay? Go ahead and lift up your shirt. Okay, for privacy reasons, again, she will be leaving this shirt on, but in real life, I will have the patient removing the shirt so I know that hearing sounds are much better on the skin rather than the clothes, okay? So, I'm going to go ahead and listen to your breath sounds at your anterior posterior in the 5 areas, okay? Breathe in. Breathe out. 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 Perfect. So your rate was 14 beats per minute. There was no and the quality was regular. Okay. So now I'm gonna go ahead and do the anterior posterior transverse ratio. Okay. So for the anterior posterior, I'm gonna do it on the side, which is a 1. Perfect. You can go ahead and put that down. And for the transverse, it is a 2. So the ratio would be 1-to-2 ratio, okay? Now I'm going to go ahead and hear your heart sounds. Go ahead and please lift up your shirt. Okay, perfect. So I'm going to start at the right sternal border, second intercostal space. And then the left sternal border, second intercostal space, which is the pulmonic valve. And then the third, the left sternal border, third intercostal space, which is the Herb's point, sorry. And then the third, the left sternal border, fifth intercostal space, which is the tricuspid valve. And then the left mid-calvascular fifth intercostal, which is the mitral valve. And since I'm already at the mitral valve, I'm going to go ahead and listen to the apical pulse. Okay. So the rate was 80 beats per minute, and there were no extra heart sounds, okay? Perfect. Now we're going to go ahead and talk about your S1 and S2 sounds. For your S1 sounds, the best hearing is with the apex of the heart, where the tricuspid valve and the mitral valve is. And the S2 sounds are at the bottom of at the base of the heart, where the pulmonic and aortic valves are, okay? So now I'm going to go ahead and assess your abdomen, okay? Go ahead and lay down. Perfect. Now I'm going to go ahead and drape you. right, put your hands by the side. Okay, so I'm gonna go ahead and inspect your abdomen first. So with your abdomen, it seems symmetrical. With your umbilicus, it's midline as well as it's inverted. There are no signs of pulsation, no stray, and no edema. And your skin seems to be smooth and even. Okay, now I'm gonna go ahead and auscultate your abdomen and listen for your bowel sounds in the 4 quadrants. Okay, so first I'm gonna listen in your right lower, and then your right upper, and then your left upper, and your left lower. Perfect. So your bowel sounds are hyperactive, and in all 4 quadrants I heard a gurgling sound, so that's okay. All right, so now I'm gonna go ahead and palpate each of the 4 quadrants. Okay, so do you feel any pain here at the right lower?
No.
So no tenderness and no superficial masses. Do you feel any pain here in the right upper?
No.
So no tenderness and no superficial masses on the right upper. Do you feel any pain here on your left upper?
No.
So no tenderness and no superficial masses on your left upper. And do you feel pain on your left lower?
No.
So no tenderness and no superficial masses on your left lower. And as I was palpating lightly, and now I'm going to go ahead and palpate the bladder. Okay? As I palpate your bladder, do you feel any pain or discomfort?
No.
So she feels no pain, no discomfort, and no distinction. Okay? That is the end of the assessment. That's it.